Thank you, Eva, and thank you for the water. I have this clicker. Hello, everybody. Good afternoon. Hope you had a good lunch. There, I think now the mic is working. So we do have a big group, and we're never going to, unfortunately, because of numbers, be able to share across as much as I would like in when we have small group discussions. So I want to encourage you to do two things, one or both of two things. When we do have discussions around the table, please either tweet with the hashtag that's on the back of your program, or just use one of those slips of paper to jot down what you're finding. And if we leave them on the table, we'll be able to collect them, and we'll all be able to get some sense. Maybe we'll put something up. I might try to put something up on the conference website, and so that we can sort of share more than we otherwise will be able to. Let's see. So we have, in our 1 hour, there are 3 things I want to try to do to walk you through a case study of developmental evaluation and give you a chance to engage on it a little bit. So the thing that my team was evaluating is called Frontiers of Innovation, which is an initiative in early childhood development. So I figure I got to kick off by telling you a little bit about what that is. Otherwise, what follows probably can't make much sense. So that's where we'll start. And then kind of in the meat of it, in the middle there, we'll talk about what we did as an evaluation team for the first 3 years, just ending now, of the existence of this initiative. The initiative isn't ending, but the 3 years are ending. And then we'll step back a little bit and try to identify, well, if this was at least one experience of developmental evaluation, of trying to do what Kathy described this morning, what lessons might there be that are more generalizable in it? And so after each one of these 1, 2, 3, we will have some time to talk at your tables, and then just a few at the microphones. But that's my point. We can't possibly get everyone to the microphones. So please remember about other ways to record what you're thinking so others can share it. All right, so what is this thing called the Frontiers of Innovation? It grew out of the Harvard Center on the Developing Child. The underlying reality that I came sort of into closer, I suppose there's a sense in which we all knew this, but when I looked, having been called in to join this group, at what the science is telling us about what happens to little children if they're exposed to too much stress from the pregnancy period into the early years, especially, and how that potentially blights their whole life. And this is happening to very large numbers of people as a direct consequence of the way our society is organized. It's a consequence of poverty in North America and around the world. And when I first sort of saw that from the material at the center, I couldn't sleep nights. It's unacceptable. We can't, what are we doing with these little kids that we're robbing them of their birthright like this? So I don't mean to rob you of your sleep either tonight, but the underlying motivation is, can we do something about that? Now, obviously, a lot is being done. Our society does put resources into early childhood development. The origin of this idea of frontiers of innovation was that Jack Shonkoff, the leader at the Harvard Center on the Developing Child, has been for years pointing to this science in discussions with policymakers, translating it into policy-friendly language, and trying to persuade people, you've got to put more resources into this, got to put more resources. And people started, the way he explained it to me, people started to get convinced, yeah, maybe we should. And then they asked him, well, so what should we do? And this gets back to what John Kania was saying at the very beginning. Well, we do know some things that we can do that help, but the problem seems to be getting increasingly complex, and we don't really know. So the idea of having a community, a learning community, that's trying to sort out better intervention strategies to feed in to an already stressed system a system which, in practice, in the near term anyway, is not going to be able to get large numbers of new resources because, for separate reasons, those are lacking. So if you look at that goal there, that's a nice, modest goal, breakthroughs in strategies. Well, the ambitiousness of the goal is also the humility of the goal, in the sense that we don't know how to do that. It says applying knowledge in science, policy, and practice, and God knows there's a lot of knowledge out there. Scientists have knowledge, practitioners have knowledge, people in policy positions have knowledge, mothers of little kids have knowledge, teachers have knowledge, tremendous amount of knowledge out there. But what we don't know how to do is to combine that knowledge in a way that actually is game-changing for the outcomes that we get. So this is going to be, if it's going to happen at all, it's going to be a long and difficult game. There's how it started. In 2010, a team of people from various organizations did a series of scoping interviews. They interviewed about 100 people across the research community, the early childhood practice community, the policy community, to try to generate a sense from the field of questions we asked were things like, what do you think is the most promising avenue for getting better outcomes? What do you think are the barriers? Why, if we're stuck, why are we stuck? If there are pathways, what do they look like? And what emerged from all that, after spending a lot of time, I love this phrase that Kathy had of meaning-making sessions. Spending a lot of time trying to make sense of all this interview data that was coming in. The leadership of the initiative pulled together a convening of about some 70 or 80 people with a lot of overlap with the people who were interviewed, but not exactly the same, on the topic of reducing barriers to early learning. That came out of these discussions as an area that may be ripe for, hey, maybe we could do something about this, that kids are arriving in kindergarten facing barriers such as, well, I'll give an example. They can't sit down and pay attention. It's not that they won't sit down and pay attention, it's that they can't. And there's a researcher out in Oregon, Phil Fisher, who showed me this. You can now image little kids' brains, and if you're brought up with various kinds of stresses that are inevitable under poverty, then your brain, there are certain things that develop differently, at least in the beginning. And one of them is, he shows this, if you say, please sit down and be quiet. You have a kid who maybe middle-class background or something, you can watch the brain patterns, and it goes to this part of the brain, and goes, kid sits down. You watch some other kids who aren't mentally impaired or anything, but you watch what happens, it goes in one ear and out the other. There's no response. They can't hear it in the sense of a request to do something. They just don't, they haven't gotten there yet. So if they arrive in kindergarten like that, there's a risk that they're going to be characterized as bad kids, that they're going to be given attention deficit drugs, that they're going to be on a pathway in life that even right then from there is going to be radically unjust. Anyway, so we thought, hey, maybe this is an area where we can make some progress. It's a big policy area, what to do about kindergarten. Right. Well, that's a nice slide. All right. So to this event, to this convening, which was multi-stakeholder, the group brought a scientific, quote, theory of change, an idea about how science could contribute to addressing that problem of little kids who arrive not ready to learn, as the expression was. At least not ready to learn kindergarten style. They can't do things like sit down. So, here, I'll have you sort of flip through this pretty quickly. If you think about sort of a nested network of the environment, there's the caregiving adults, there's the stability of the family in which those adults are operating, and there's the neighborhood. And so this is not rocket science, it's an idea, it's early childhood development science, I guess. It's an idea that says, got to pay attention to all of those levels. and maybe we can make some progress. Now here's the basic design. This is a learning community. The objective is discovering how to apply diverse forms of knowledge to this problem. The initial problem being set as reducing barriers to early learning. And so there are two basic functions in the design. One is connection, bringing people together in convenings, connecting them on the web, trying to break down silos. But the thought was that's not enough. It's the kind of thing that happens from time to time anyway. People try to connect the dots. So this idea of acceleration was that you take microcosms called innovation by design groups and try to create conditions where they can really move the ball. So in connection, the thinking was that you would connect people around ideas to action, like a particular intervention strategy, and then you would find locations where people would be interested in this innovation by design idea, so that a group of innovating states and a group of innovating community level sites, and they would be experimenting with ideas around reducing barriers to learning. So that's how it started, and I'll show you a little bit about how, I have to flip fast because I can't make this a whole thing, a talk on frontiers of innovation. As you can see, it started to fill out. This is by 2012 now. We've moved in a couple clicks from 2010 to 2012, and we have groups in New Haven, we have groups in Washington State, we have a group in Washington, D.C., building family and community resources at the Center for Social Policy, and so on, so on, so on. Right. So now, that's a quick, I'm sorry, over quick introduction to the frontiers of innovation. If you would now, at your tables with one or two neighbors, not necessarily around the whole table, if you can identify any burning questions, this is a flame tulip, burning questions either about what I just said, what is this thing? What is that group trying to do, frontiers of innovation, or some challenges that you see in evaluating which could help prime my pump, because my next topic is going to be how we evaluate it. So if you have some things you want me to be sure to cover in discussing how we evaluate it, this is a moment to put those burning questions on the table. So let's take 3 minutes to come up with a burning question or two at your tables.
Hi, my name is Larry Litvak, and my question is, in the particular issue area you're focusing on here, there has been a lot of experimentation and program interventions over recent years, and a lot of evaluation, including randomized controlled trials on many different components of what these programs might look like. So how did you incorporate the knowledge from evaluation that already existed in your effort, and also specifically how did that affect in any way what you prioritize to try and focus on in evaluating on an ongoing basis your own program?
Okay, maybe in the interest of time, can we have 2 or 3 more, and then I'll give a round of answers? I think that'd be a little faster. Thank you very much. It's a great question.
Okay, my name's Beth Cantor, and I'm a blogger, not an evaluator. I'm an accidental evaluator. So I'm curious about what methods did you use to quickly capture, learn, and spread the learning, and kind of like around. It looks like it's all this distributed experimentation. So like, what does a distributed feedback loop look like?
Thank you very much. Another very good question.
Thank you. Hi, I'm Teresa. I think at my table we had, our burning question was, from your perspective, I know we heard Kathy earlier kind of define developmental evaluation, but maybe from your perspective, just in a quick nutshell, if you could break that down for us. And we wanted to know, how does it differ from basic strategic program development? Thank you.
Okay, thank you. And one more.
Okay, we had a few quick questions at our table. What was the selection process used for inclusion in the study? How did the evaluation incorporate the diverse regional context and likely diverse program implementation that was happening across sites? And then what is it that you're evaluating? The architecture of the innovation, the early learning goals or outcomes, the systems change, and more clarification on that.
Okay, thanks very much. Those are all really good questions. I can't do them justice, but I'll do what I can. So one of the things that the Center on the Developing Child had worked on, in fact, was a meta-analytic database that attempted to harvest, this is to the first question, harvest existing evaluations in this space, and then roll them up through meta-analysis. I guess this connects to some of the presentations we had, that was your question, this morning. And they came up with some very interesting results that were shared in this community. I can talk to you about them later, but I need to move on to cover some of the other ones too. So then there was a question about the very distributed nature of the community. How did it share? It's an ongoing challenge. And I would say, there was that 1 year of preparation and then 2 years of operation doing this. And I don't think it's been successfully tackled. That would be one, as a developmental evaluator, I would say they need to get better at doing that. They have been focusing on making all those distributed centers, if you will, have the resources that they need, helping them have the resources they need to do what they're doing. But there could be a lot of, right now the sharing is mainly being done by people picking up the phone and calling each other who know it. It's not a bad way to share, right? But it is not a systematic, supported way to share, either lessons or data. And then there were two questions, I think, about what we're evaluating and how, and in what sense it is a developmental evaluation, and what sense it links to those 6 themes. Let me try to weave that in to this next section. So we're now in section 2 here. So why did we choose developmental evaluation, which I better then, I guess, quickly redefine. I don't have one immediately in my head, but I'll see what pops up. So developmental evaluation is an evaluation tool that gathers evidence and feeds it into a program design that is developing over time. So it has this quality of iterative loops. Information is coming in, it's being assessed, and it's going out in the field again in real time. So this initiative, the fundamental thing, remember it talked about applying knowledge there, but the opening problem is we don't know. We don't really know how to do this, how to get better in the context of, unfortunately, very limited resources. We don't know. So the whole initiative is going to be emergent. We don't know what pathways are going to work. So that seemed right for what I just said, right? There's not a clear roadmap with signposts that we can say, well, you're at year 1, did you reach this signpost? It just doesn't exist because we don't know. And then a second feature that I think makes this right for developmental evaluation is the sheer complexity of it, that there are so many different categories of stakeholders, from policymakers to neighborhood leaders and parents and everything kind of in between, if you will, forming in these organic groups, trying to sort out problems that make sense locally to them, but also might have wider application. That's a complex system. We heard something about systems this morning, too. So again, developmental evaluation is suited to that because it's able itself to adapt to the system as it goes through its process of inquiry, reporting back, and processing. And secondly, the management, I guess I'm force marching all this information to you, for which I apologize. I don't know another way of describing the case, but I don't want it to go completely without saying that this is so many people are involved in this initiative. It has leadership all over North America doing all kinds of things. This is not my work. I use this word "we" very loosely. I didn't do it, and I don't want to claim credit for it. And I can't name all the people involved because it's too long a list. But I do feel I ought to at least acknowledge sort of the role of Jack Shonkoff, the leader of the Center on the Developing Child, in nurturing this from his idea, and also my partner in the True Point Center group, Nathaniel Foote, who has played such a wonderful role in helping us figure out some of these things out in terms of how to evaluate this. I think there was a question. My role here, and what I'm trying to describe, is the story of how to evaluate the initiative as a whole, not any individual part. The individual parts very typically have their own evaluation, right? They're being funded, and often it has to do with accountability to a funder. Query if that should be the only reason to do it. I don't think it should be only. It's not even a query. So they have their own evaluation designs, and then there's this community, this broader thing that's a learning community that is trying to make the whole greater than the sum of the parts, and it's on its own learning journey. And that's what my little evaluation team, myself and a few colleagues, have been trying to assess through developmental evaluation, the progress of that community. So the first thing we did, now that we had this, so management interested in empirics is simply that the leadership, Jack and his colleagues at the Harvard Center, they really walked the walk as well as talking about, they wanted to know, they wanted data about how this was going. They had spawned this thing and were passionately committed to it, going out there helping to co-create these mini learning communities that I had up on the board there. They wanted to have the feedback. So again, that's ripe for developmental evaluation, because developmental evaluation is a partnership with the leadership of an initiative and an evaluator. They're not pulled apart as they are in traditional. And they wanted to be engaged. They made time to listen and to figure out what are the data telling us. And then, as I say, at least one smart thing we did is we started, before we even tried to create a design for this thing, we invited Hallie Preskill and Michael Quinn Patton, two grandparents, if you will, of evaluation. And Michael just had a grandchild, by the way, so he actually is a grandfather. Someone before was saying, it's very good news. Anyway, they came and they gave us a wonderful workshop and gave us some follow-up time too to sort of begin at least to figure out how the heck to do this. And I'll show you quickly what we did then. We had an annual cycle to this, frankly, because a leading funder wanted an annual report. So we said, all right, we better design this so that we're ready every year to write an annual report. There were the traditional ways of gathering information from a multi-stakeholder initiative like this, which is letter A, and to some extent letter B. We did a social network map. We used some tools around that, both at the beginning and then later, to see how were we improving the connectivity of the field across silos, if we were, or if it was improving maybe. You never know how to attribute in space like this. And then we would have these periodic, I'm using Kathy's wonderful term for it, meaning-making sessions. We would sit down and say, okay, so that's the data that are coming in. In a sense, we, the evaluators, brought that to the table each time. Our goal was to do this every 4 months, these meaning-making sessions. And then we sat down with both the leadership and staff of the initiative and said, all right, what is this telling us? What's really going on? We didn't succeed, by the way, in doing it on clockwork every 4 months, but we came decently close. And then we wrote up, with these sessions as keys, we would write up these annual evaluation reports. And then what then happened was, those reports were fed into something else that got the label green papers. A green paper in some parliamentary systems is sort of a discussion document that they go. So what happened was Jack would read the developmental evaluation. He was part of all this processing. And he would say, OK, I want to now put a message out to the community. So this was a paper he would write that was distributed around by now it's 500 community members, and there would be another convening, and they would discuss it. So that's part of the loop here. There was an annual report. The green paper was a different thing, annual green paper, then back into getting all these various forms of feedback and discussions. All right. We did kind of evolve our way into how this worked, and I guess I'll bring out just one aspect of that, because I do feel an urge to move, a need to move on with this clock ticking like this. We started out, we engaged, every time we did this, we had outside interviewers. So I didn't do any of the interviews. I have a kind of midpoint stance in this because on the one hand, I am outside, but on the other hand, I'm a fellow at the Harvard Center and I'm a thought partner. So I'm kind of in the middle. So we wanted the interviewers to be fresh new to what this initiative is, and being able to bring in a completely fresh perspective. So we hired a first-rate consultant to do a round of interviews and give us a report and bring that report into one of these meeting-making sessions. And that's how we kept doing it. But we learned something the first time around, which was that the consultant interpreted their mission, if you will, as a consulting mission. So they were bound and determined, having done the interviews, to write us a cool report saying what we should do, or what the group should do. And it had it had useful ideas, no question, but it wasn't developmental. It wasn't this iterative process of data into the system. The system itself looks at the data and reflects on it. And so we decided, first of all, we'll hire someone different next time, but also try to get the terms of reference right, if you will. Try to make it more clear what it is we're really doing. So that's an example of evolving method. And so what did we find? Well, this, in short, things evolve. And I'll try to walk you through some of the various things that seem to be moving as we went along. So this is an evolving theory of change. So it started out, if you look at the top left there, where the whole theme, we thought we would be working on this problem of kids arriving in kindergarten not ready to learn, and working on that for some years before we branched, if ever, to other things that would seem to be enough to bite off. But the feedback from the field is you cannot separate that from health, as a matter of fact. And so this split between, even though in the room at the beginning, they were all, or virtually all, early educating professionals. That was the field they were drawn from because we thought we were going to be talking about, and we were talking about, early learning. And it isn't as if that they rose up as a group. But anyway, the feedback over time became very clear: don't separate this. Get the health people in the room and get them in consistently. And there are a lot of other examples of how it's a funny thing. I think we got sharper focus by actually broadening the aperture. So it's kind of an interesting learning. And you'll see several categories, but I do have to keep moving. I would like to show you how the architecture changed a little bit. So this was the picture I put up before. It was the plan. And this is a new pattern that emerged. So it's a community-based innovation cluster. That's the label we gave it. We spotted it, I don't know, maybe 8 or 12 months ago as part of this process. We found that where the most exciting action was when there was a community hub. A good example is New Haven, Connecticut, where there is what's called the Moms Partnership, a partnership of community members, mothers who are on the guide group, and academics, and government at all 3 levels, and service agencies. And they're a real partnership, that's the thing. They meet on the ground, they have a level of trust, they have a level of engagement, they're working on the problem. And they are able, because of that, they are able to pull in top researchers from, it's New Haven, that's a particular one, so that's Yale up at the top there. And then if you look on the left, those are various intervention strategies. Some are owned, if you will, or developed within the hub, within the community itself, right? So you have innovators like Jessica Sager with a group called All Your Kin in Yale, who's doing really cool stuff with informal family daycare, unregistered informal, helping them get better at what they do. So that's sort of within the circle, but also they have a window in, because they've got a network that's alive, they have a window into people doing stuff in very different places that they pull in. So that's the far left there. And then on the right are the agencies that are doing the pulling. And there too, there can also be connections to agencies outside the hub. That circle on the bottom, having institutional sponsorship. In this case, it's Yale University with a grant from the federal government. But it typically does need to be a pretty big institution with a pretty big funding source in order to keep all those moving parts in play effectively. So we started to develop learning. This was a new pattern, and we started to figure out a little bit about what it takes. And again, I can't start listing bullet points here. What it takes to make that work. What you have to have in order for that thing to really start to generate new stuff. And they're doing really wonderful things in New Haven. I mean, I want to give a too small example. So stress is a big deal. And it's a big deal and has health consequences for pregnant mothers and their little children. And the mothers were complaining, and they said, we want yoga. So they got yoga. And there's a certain thing there. Yoga is not an evidence-based practice by the definition of the federal government. So we had to kind of go around a little bit of an end run there. Just an example of a vignette. They're able to hear voice at the community level. The problem is shared to a remarkable degree across these different disciplines and sectors. And then they work on it. They actually try to come up with something to do about it. All right, so I was trying to say the architecture evolved, the theory of change that was back there evolved. I can't keep going back. And the roadmap, to the extent there ever was a roadmap. I was saying before that we didn't really know how to move forward, but there is this sense of trying every year. Every year we did this, we tried to create some kind of map about what we were doing and where we were going. And we started with what we thought. After the first year, we had this great aha. I said, aha, there are 3 stages to this. And now, this most recent one, the report is right on my computer today, we say, aha, there are 3 phases. They're completely different, the 3 phases and the 3. You don't need to know what they are. But the map, this is an old map of Massachusetts, Random McNally, 1920 or something. That's evolved too, of course. Right. I guess I had some points about what evolved in the roadmap. Okay, so those 3 arrows, I'm sorry, the volume seems to go up and down, I don't know why. Those 3 arrows are 3 recent learnings about what we're doing. One is we discovered, we should have known this, I'm sure as many of you could say, but we discovered we needed to have an on-the-ground component of everything we did. That the idea of policy innovation is very cool, and there are policy innovators, and they innovate with things like incentives and systems, but that the particular value added of the Harvard Center on Developing Child and its scientific theory of child, you need a child. You need a child in the mix there, because that's what that information is about. And so we discovered that. And we discovered that, yes, it was wonderful to have policymakers in the room, but they needed to be in the room with people who are on the ground. And with that insight, the next one came along was this idea of vertical alignment, the idea that if you could get common agreement from the level of the parents through to the level of the agencies, the community, the state, the policymakers, the funders, if you could get agreement about what we're trying to do here, you could then have a discovery frame about what the best way to do it, and everybody could be pulling in some sense in the same direction. And the horizontal networking idea was the question from over there that I don't have a good answer to, which is the idea that says that each of these clusters ought to be able to learn from each other. And so what we're trying to think about is, right now, is can we set up thematic groups? Can we find volunteer leaders who are interested in leading groups like that, so that it's just not going to happen on its own, so to create that kind of learning. And this point about leadership, that was a third discovery, that there's a certain sense the game Frontiers of Innovation playing is a leadership development game. It's about providing for leaders a context where they can do more than they've been. It's not that they're not good leaders. They are good leaders. They can do more than they were able to do before. They have an enriched space in which to operate, more connectivity, room to do something like yoga that isn't what is on necessarily a menu of things that they're being told they have to do, et cetera, et cetera. We're trying to create space for ambitious leaders to reach higher. And it turns out that that's more the game than what we thought it was 3 years. I tried to show you what we thought it was 3 years ago. All right. And then since the roadmap is evolving. This is a feature of developmental evaluation I would just like to get on the table quickly. We had this idea of an evolving scorecard, and this is just an excerpt from it. It's a much bigger, it goes pages and pages, but stage 2, point A or 3 or whatever the heck it is, you don't have to worry about the text there. The thought is that we have something of a rough roadmap at any given time of what we think is going to be happening and should be happening over the course of the next year. So then we go, let it happen, look at it, and say, well, what really did happen? And then we have to revise the roadmap because our understanding of what we're doing has changed too. So that's what I mean by an evolving scorecard. There's a set of indicators that are supposed to test progress, but as opposed to them being static and saying, well, you're failing at this, and then next year you're still failing at this, so you better get better at this, the message is often, this isn't working, maybe we shouldn't have been doing this in the first place. Maybe we should shift our energy to over here where it is working. So when something comes out, yellow on the chart or something, that doesn't necessarily mean work harder at that. It may mean just the opposite. And so a new scorecard will come up that may be closer to, next year, what the initiative really ought to be doing. I doubt it will ever end. I think it's the nature of the beast that it keeps evolving. And then the evolving role of developmental evaluation. I was so struck when I went out to visit one of these innovation clusters last week in Seattle, where Hallie lives. I had a wonderful lunch with Hallie and her husband. But I was visiting this cluster, and it did have this wonderful heterogeneous quality to the people around the table. There were about 20 people, and we invited them all, it's developmental evaluation, we invited them all to talk about what they had learned in the process of doing this. And what was so striking to me was how often people said, my whole view of my work has changed. I have a broader sense of what's possible, and I'm able to be more reflective about what I'm doing. And I said to myself, gee whiz, that's just what a developmental evaluation is supposed to do, right? Help people take a broader look of the whole system and then reflect more. And they were embedding it at the level of their own personal work. We had frontline agency staff people saying this, that they're tired of being locked into this is what we do, and then this was a chance for them, as well as policymakers. It was fascinating. And so I rather whimsically pulled up this is called a Julia set. You don't need to know the mathematics, but it has the same sort of thing happening at lots of different scales. Those beautiful little spirals go down all the way through to infinity. And so the idea that there's developmental evaluation happening at the level of the whole learning community, but then this group, say the one in Washington on New Haven, are meeting periodically to evaluate their own progress. And then even within that, there's another, that each agency is becoming more reflective about what it's doing. And then the frontline staff in those agencies. So to me, we're moving in that direction. We're seeing that emerge almost spontaneously. And a challenge I take, I'm very interested in people's thoughts about this is, well, how can we support that? Can we help bring that to life over these next years? I really liked Kathy's before action, after action review questions, because they seemed simple enough to maybe that could be a common language that we can use at these different dimensions. That's what this fractal thing is supposed to be. Okay. Again, I want to pause, and I think groups, you can do it in groups of your whole table, half your table, or just 2 or 3. It may be better 2 or 3 just because time is so short, and I want to give everybody a chance to get their views into the room. You could do one or both of these. A challenge you see in what I'm saying we're trying to do as evaluators of this initiative, and or a possible idea, solution to that challenge, or just, here's what you might consider doing next year. Can we spend about 5 minutes on that, please? And then we're going to same thing. Tweet, write it down, or come to the microphone. Okay, thank you for coming up, and if we could give our attention to our commentator at the mic over here. Thank you.
Thank you. It's very provocative, your talk. And my name is Jane Burnsweig. I work for one of the first 5 organizations in California. And my question, I was really struck by the leadership piece that you talked about. And what I'm concerned about, and I want to see what you think, is all the different areas, places where you have these programs. It seems like they're backed by major universities, and it seems like for any of this to succeed, it has to have the kind of backing of a strong university leader, somebody like Jack Shonkoff or somebody like that at Yale. And I wondered what your thoughts about that are, because, like, for example, in our first 5 agencies, we operate much more, sort of grassroots organizations, and I always am concerned about our future in the work we do, because we don't necessarily have those partnerships.
Cool, thank you. A couple more and then I'll try again. I don't know how successful I was last time of addressing them all at once in the interest of time. Please.
Yeah, you had that slide that had the list of the 5 things that you took away or observed. Right there. Yeah, what did you find? I'm wondering, what wasn't clear to me in this slide is what value these things added to the work. So I wonder if you could speak to, these are things that you observed happening over the period of time. What value did the developmental evaluation add to the work?
Great question, thank you. Thank you for reminding me to include that. If it doesn't have value, it kind of doesn't have value, does it? Okay, your question about a university partner, I remember in a somewhat different context, there was a forum, a leadership forum that the government of Scotland, which is, by the way, doing wonderful work in community development. And they had community leaders and government leaders. They invited me to talk about similar things, not this exactly, but they popped up with that question too. That's why, hey, we're here in Scotland, we don't, have Yale, and then, I encourage them to think, oh, yes, you do. I mean, they have institutions that are able to step back and think about data and work with communities. Edinburgh and Glasgow, they have some world-leading ones, but they have universities everywhere. And I guess, I don't know that it has to be a university or a community college. We have a partnership with community college. But I do encourage the idea, this particular model does have, as part of its DNA, if you will, that there's some kind of research connection that's helping to stretch people's thinking, if you will. And it's not the only way to innovate, and it is not the only way to improve child outcomes, but partly because I guess it started at a university home. It's trying to figure out how to maximize the value from that kind of connection. And then as to, these things evolve, and so what, right? As a what, so what. They had the effect of changing at each stage the way the initiative used its resources. So, for example, the idea coming into the state of Washington, I remember I visited there again recently, was that state leadership going up to then Governor Gregoire were very interested in applying some of this science to improving their policies. And so we thought we had a state policy program going, and we staffed up and geared to have connections made at the state level and support the state. We discovered that you needed this different model, different architecture. You needed to have stuff happening on the ground. And so we flipped. In midstream, we flipped what the staff was doing, brought in different staff in some cases, with the agreement of the state, too. I mean, this wasn't tense. Sometimes, whenever you change, some things can get tense. But in other words, the reports coming in about what was working and what wasn't, that were causing this evolution on these various dimensions, had impact on what the initiative actually did. That was in significant part because the leadership of the initiative was, as I said, deeply committed to empiricism. They wanted to learn. And also, frankly, the funders were really, this gets to a point that Lee Shore was making, the funders were really, the sense that the funders wanted from the point of view of accountability, back to learning and evaluation, proving and improving, The idea that there was a rigorous, including external process going on here that identified what was working and what was not in real time, and then connected to how resourced, so that their money was being spent in the most efficient way that at least that system could figure out, right? Not perfect, but it's better than having no feedback, and it's better than having, I think it's better than having the feedback be only informal and spontaneous as opposed to a structured. I think we learned something from doing this structured process, in short. And the funders have seemed happy, I'm glad to say, with the reports they get. They come back and say, oh, wow, and they comment on it. So in a sense, funders have been in the dialogue here, which is encouraging. That may say something, and something quite positive, about these particular funders. I don't know. Right, so we have 10 minutes, according to our happy organizers. So I want to take maybe 3 of them, those minutes, to put up in this lessons and reflection space some thoughts about, now that we've done this for 3 years and are in the process of writing our 3rd report, what we think it means. Okay, well, we'll make it faster than that. So I'm going to go through them very quickly, and then I'm going to encourage reactions. Again, the reactions can be in any of those 3 forms, although we won't have time to have table discussion and reaction, because I just got the high sign. But we will have the opportunity for reaction. So, evaluation space versus decision space. What we discovered here, we had already talked about the difference between proving and improving. You know, that's a classic learning and evaluating. But there's another, if you will, there's a subdivision here. The reports that we did informed the strategy and the decision-making of the organization, but they were not the strategy or the decisions. They opened up, by having this developmental evaluation, it opened up space for the leadership of the organization to hear feedback and talk about what it means without having that day to make a decision and say, okay, I'm going to take resources. They could process that as a second step. And so there was more freedom to just tell it like it is. It was more open space. It was kind of a learning space that could inform strategy. So the difference between the developmental evaluation report, which the evaluators owned, that was me and my colleagues, and what we called the green paper, which the management of the initiative owned, there was a difference. They fed on each other, but they were in dialogue. And we discovered that having that distinction, I think, made them both better. That connects with this idea of inside-outside collaboration. There was always completely outside views coming in, feeding into the system. And I just wrote down, 3 kinds of things that happen. You have observations. People have different sense of reality. Everyone in the system offered their views of the elephant. That was really important. And then there was a reflective process of, okay, now that you've heard what everybody else is saying, what do you think it means? What are some common themes? And then once we had processed those themes, we went back yet again and said, okay, here are some themes. What does it all mean? The sense making, which I now am going to turn to meaning making. I think that's, Kathy, I think that's nicer than sense making. Try to make sense of it all. What are the patterns? We spotted some patterns and that way. All right, so this was this sort of, and the 3rd point builds on that every time, every year, there was a significant reframing. There was a significantly new way of thinking about what is the game FOI is playing. As I said, leadership development is sort of the latest and greatest. It's going to look different a year from now. So that was kind of interesting to learn. The evolving scorecard, I think I've discussed. The fact that there is a scorecard. I mean, there is a way of assessing on a kind of continuous basis, how well is this doing, but that it's not fixed. The evaluation method itself evolves. I think that turned out to be very useful. I think if we had no scorecard, we wouldn't have been able to be as good at feeding in this what works and what doesn't. The fractal dimension I talked about, and this last one here, the urgent versus the important. It was hard to get those meetings set up. To do it once every 4 months. And it was hard to get those reports done on time. If the funder had not required the reports, I don't think it would have happened. And so that was a constructive thing of the funder to have done, in the way they framed it up. But I think we all feel that these kinds of reflective processes are things we ought to do in our lives and our work. They're useful, but they tend to get driven out by the urgent day-to-day. And this process helped make some space. And I think it played a useful role that way. Now, to the extent that the organizers say we have time, I want to welcome people to, again, tweet, write down, or come to the microphone with any reactions to this. I think we're going to be in tweet and write down space. So I hope there'll be a way to collect what's written down at the tables. I'm really interested in what you have to say, folks. I'm sorry there wasn't more time to dialogue.